If you've been thinking about starting a ketogenic diet, I encourage you to just do it. Yes, you are the reason why I started this podcast in the first place. More than anything else, I love to empower people to take responsibility for their own health. And for so many people, a ketogenic diet is the most effective way to reverse metabolic dysfunction, which is the very foundation of all chronic illness. But to do this effectively, you need 3 specific tools or you're going to struggle and you won't see results. I do not want this to happen to you. So I give you these 3 tools in my free ebook, How to Start a Keto Diet. And you can go download your free copy right now at radicalhealthmakeover.com. Welcome, Dr. Felipe Hayashi. I am very delighted that you have chosen to join me today. I know how busy you are, and I really honor your time and so respect the work that you've been doing. I was introduced to you through a mutual friend, Dr. Claudia, and originally in pursuit of alternative treatments for my daughter who was diagnosed with cancer. And I went to seek out as much as information as I could about alternative therapies, and you showed up in the picture. And of course, I feel that we were very much divinely guided to find you, and so fortunate. So if you would, Dr. Felipe, just share a little bit about your story and how you got started with working with ozone therapy.
Okay, well, I'm Felipe Hayashi. I'm from Celaya, Guanajuato, here in Mexico, and I studied for physician at the Universidad Autónoma Metropolitana at Mexico City, and afterwards I did the specialty on general surgery at Hospital de Tizapan in is nearby to the Mexico City also. Well, and I began with all these ozone therapy after I got a bad case of COVID, and I was dying. I was with 72% of oxygen saturation. So I called one of my friends and I told him, hey, bring your device here because I'm dying from COVID. So he put ozone therapy on me. And I left the oxygen supply after 3 days after the therapy. So I went to Mexico City to learn more about all these alternative now ozone therapy. So I began working with my patient also, and during the pandemic, we treated a lot of patients from COVID, and with very good results. Most of them recovered from the COVID, and we have a few that died, but they didn't take the treatment on time. There was so late for them, so they were dying practically. So we couldn't save them. But the ones that did the treatment before they could have complications, they recovered at 100%. Also, we have treated a patient with cancer and with pain, chronic pain, with very good results. So that's why I opened my office about 1.5 years here in Guanajuato City, and we're treating the patients with ozone since then.
Great. Okay. And that's where I found you, in Guanajuato, which is where I've been for on and off for the last few years. And I've been to your clinic. You've been to my home. You came when my husband and I had COVID as well, which was amazing. And I mean, we had symptoms for 3 days. Just felt kind of like a regular flu, nothing very extraordinary occurred, and we just started feeling better right away. So yeah, you worked your magic on us, and we've been sharing out with all of our friends ever since about how amazing this therapy is. And we've also been using it just as prevention and longevity and joint pain, or just to kind of keep the system running clean and smooth, and also getting rid of any cancer cells we might have. Everybody has cancer cells in their body, right? And maybe you could just speak a little bit to that and how ozone affects cancer cells in particular.
Yeah, well, the cancer cells, well, they are more, um, how they call that, oxidative. They are in a an higher oxidative place for that. So we have to put and ozone. It works with one of the molecules of the ozone has three atoms from of oxygen. So this oxygen releases one single atom of oxygen, and that atom goes into the cancer cells membrane, and the cancer cell hasn't a way to use the antioxidants, because they don't the cancer cells doesn't doesn't have any antioxidant. So this atom of oxygen breaks the cell membrane of these cancer cells and uh, destroys them. So that's really good, because you can see after a time, maybe 2 or 3 weeks of intensive ozone therapy, you can find that the tumor could get smaller in the patient. So that's very interesting. And well, the oxygenated body hasn't any cancer or diabetes or whatever. You can with the ozone also works with the fat of the blood, and it diminishes all the triglycerides and the glucose of the blood. So this is a really good therapy. No, also not only for cancer patients, but also could be any kind of disease, because we have this redox system in our body, and if you get sick from one infection or you have a problem with your back or your knees, your oxidative state is higher. So the ozone helps to stabilize all these oxidation more at the patient, though. And it works uh, uh, making this strange thing that call it the anti-inflammatory, how they call this is and I forget the the English word, maybe in Spanish. Yeah, it's kind of, you oxidate the cell in order to get more antioxidant process into the cell. Yeah,
Okay.
it's a quite strange thing, but that's the way the ozone works. Yeah, the ozone oxidates the cell, and the cell metabolism turns into the anti-inflammatory parent to get free from that this excess of oxygen. So we need also to give to the patients vitamins the vitamin C, and multi B complex, and we use a lot of vitamins in order to restore all these redox system and improve the patient's state of disease. Well, the ozone is really a good therapy, not only for patients with cancer, but also could be with diabetic patient or with autoimmune disease like lupus or rheumatoid arthritis also.
Okay, excellent. So it reduces inflammation systemically. It's
Yeah.
delivered, correct me if I'm wrong, but it's delivered through an IV. So it's an IV ozone therapy that you're specializing in, which
Yeah.
is quite different from, for example, hyperbaric oxygen, which many people have heard of for the treatment of cancers. And how does this differ from hyperbaric oxygen?
Well, the hyperbaric oxygen, you have to have a chamber. So you put an amount of oxygen that is very very high, yeah, because normally we manage 21% of oxygen in the atmosphere, but you can't give to the patient more than 20, this 21% of oxygen. It could be the half, the 50% or even more, depending on the what result you wanna have with the patient, and that is only oxygen, huh? And it helps.
And they're
Yeah,
breathing that into their lungs.
yeah,
The oxygen, it's a chamber filled with
oxygen.
oxygen,
Yeah,
gas, and air and other
yeah,
molecules, of course, but they're inhaling this into their lungs. And that cannot be done at high levels because it can be damaging to the lung tissues
yeah,
and other tissues. So is that correct what I'm hearing you say?
yeah, yeah. That's the problem with that kind of therapy, because only it is only oxygen. Yeah, and the high level of a high level of oxygen in the blood, well, it could be affect the brain or have a we call it the oxygen intoxication. Yeah, and the patient will be bad, could be feel really bad. And with ozone, you have tried the therapy, it doesn't hurt. Well, the IV does the the needle, but you don't feel any pain at all. After the therapy, you feel the better and with no pain and very happy. And
Huh.
if you have, well, you have the COVID and you didn't need more than one therapy. That was great. Yeah.
Yeah.
Also, your husband Jerome told me that he has this problem of Parkinson, and he has this tremor in his hand, and he told me the other day that that tremor is gone. So I was
Uh-huh.
really really happy about that, and
Yeah.
that we can treat the Parkinson also. Also, it's really good. This alternative therapy. Yeah, and then well, maybe in a few years in Spain they're gonna have this like medical treatment, and there are in that way. Yeah, and I hope that they do uh, in in a few years, and afterwards we could treat any kind of disease with ozone. The Spaniards could do it. Some medical centers for diabetic food and patients with diabetes, and with greater results. And all this funding is from the Spaniard government. So that's good. That's really good. Here in Mexico, well, we don't spend anything in help from the politics now, but maybe that will change someday.
It's so refreshing that there is not the limitation or the stigmatism about what alternative therapy means and what modalities can be used to actually reverse disease. So it's really exciting to me being here in Mexico that these things are widely accepted. They're studied, they're researched, they're taught to doctors to be used in their practices, as you've been doing. You are currently a surgeon at the hospital here in my city, and also have now opened a clinic outside of that practice where you're just treating people with ozone and other immunotherapies. So it's really exciting that these practices are expanding, because this is not something that is readily accessible to learn about or administer in the United States at this time anyway. So you guys here in Mexico are really leading the charge in many of these therapeutic modalities. And my hat's off to the Mexican government. It's just incredible. So happy to have you part of my team. And so we talked about the ozone being more potent than hyperbaric oxygen, because hyperbaric oxygen, if you're inhaling it, you can only have it at a certain level. So with the ozone IV therapy, you're able to get a lot more oxygenation of the blood and the tissues, and it doesn't have a negative side effect. So it bypasses that system that would be potentially detrimental at higher levels using the hyperbaric oxygen. So with that, the ozone, the oxygen goes in and it actually oxidizes the cells so that they are more vulnerable to being destroyed by the oxygen itself. So it actually damages and destroys the cancer cells. And also there's a element that it also impacts the glucose of the blood, wound healing, also infection, all of these things. So pathogens can't survive in this oxygen rich environment, and neither can the cancer cells. Is that correct?
Yeah, the ozone is really good for any kind of infection. It could be from a virus, bacteria, fungus, and even the parasites. Yeah, because they don't have this system for neutralize the oxygen. So they don't have this redox system into the membranes, the cell membranes. So this this the oxygen comes and destroys its membrane, independent of the infection agent.
Mhm.
It works perfectly for infection. Yeah, even for COVID, the monkeypox, all the pox you have around. And for herpes, this is really good because it helps you with the pain and all the herpes. Well, you get well because when you get infected from herpes, you keep the virus all the life, but it can help you a lot with the pain and all these problems problems that could be for infection. And for the well, so there is an explanation for the glucose, and it reacts with the 2,3 phosphoglycerate. Well, that's an enzyme that helps to get the glucose level to go low into the blood, into the body, and that's really good for um, the patient that has diabetes, patients of that with diabetes, and they get really good glucose levels in
Uh-huh.
the blood.
So it actually helps to regulate glucose. That's so exciting. Of
Yeah,
course, as you know, I'm very much all about keeping blood glucose levels very minimal. And, that's
yeah,
why I have been so passionate about the ketogenic diet, and also just any kind of low carb lifestyle for people, especially with diabetes, of course. But when we're dealing also with cancer, which thrives on those glucose molecules, Therapy used in conjunction with therapeutic nutritional ketosis is such a powerful way to stop the growth of the cancer cells. And Dr. Thomas Seyfried has been speaking about this for many decades now, written many books, and has published over 120 peer-reviewed papers on this therapy. He refers to a lot in his studies using hyperbaric oxygen, but again, this is going to be a little bit more potent than that. So I am very excited to be able to offer these combined therapies that work synergistically together at my upcoming retreats in Mexico. So if you're interested in that, please check the show notes, because this is a very unique opportunity for people to come for a week and relax and unwind and really just clean house, really do some deep detoxification of their body, and, really target some of these pathways that produce illness and disease, particularly the metabolic pathways, which involve nutrition and also the vitamin therapy. So you're repleting as the oxidative process occurs. We think of this as a bad thing, but really it's not. We need both. We need to oxidate and destroy, and we also need to replenish and rebuild and bring back in those essential nutrients too, as they are antioxidants. So we'll be doing both of those things, and it's very important to do both.
Yeah, it's really important to have the glucose in the low level, because when you have this below glucose level, the body doesn't work properly. So you have to keep the glucose control it in order to get well. One of the problems here in Mexico, we have too much diabetic patients. Yeah, because they like to drink sugar only.
Coca-Cola, number
Yeah,
one consumer in the world of Coca-Cola is
yeah,
Mexico.
more than US. I think. Well, they say that the US is the number one, but not
I
Mexico.
think it, I think I read it was Mexico. I believe that.
Yeah, yeah,
Yeah.
because we we drink in average. I think the double that the Americans do. Yeah.
Right. So with that, with such high rates of diabetes and obesity in Mexico, are you also seeing a lot of cancer patients as well as a result of that?
Well, yeah, you know that the obesity is a factor that increases the cancer indication. Yeah,
Right.
this is really important to be in shape. Uh,
Metabolic fitness, it's a real thing. So we are here to guide you through the process of really bringing your metabolism back into balance, your blood sugar back into balance, destroying any pathogens that might be problematic, cancer cells. All these things exist in the human body. And I think to optimize wellness and just promote longevity in the healthiest way possible, it's it's a good practice to consider, even if you don't have a diagnosis, even if you just want to promote healthy aging, to be able to do some of these protocols maybe once a year or twice a year. And so that's what really inspired me to invite people here to experience these protocols for themselves. It could be hugely beneficial for autoimmunity, COVID long haulers, cancer patients, cancer survivors, diabetic patients, also people that just want to lose weight and optimize their health. Also, there is the cognitive aspect of it too, which can be improved, like you had mentioned with the Parkinson's. But there's also, dementia and Alzheimer's and ADD and ADHD and anxiety and depression and schizophrenia and so many neurodegenerative diseases, even MS, Lou Gehrig's, all these sorts of degenerative disease processes can be stopped or slowed with proper nutrition, proper metabolic function, and restoring these basic functions of the body to help promote the healing process and to stop the progression of some of these very debilitating neurodegenerative diseases. Even I want to mention also the possible benefit, and maybe you can speak to this a little bit more, but for traumatic brain injuries that so many people have had with concussions or sports and things like that, where we have decline in the mental capacities.
Some patients with problems with depression and that are depressed and with ozonotherapy, they got a better feel of life.
Hmm.
And we had one patient with now two with Guillain-Barré syndrome that is a flaccid paralysis of the body after you take a vaccine or an infection, a viral infection. And one of them recovery at 100%. The other, well, it began to recover, but the problem were the the, uh, the relatives didn't take care of him, so he didn't make it.
Wow.
The family didn't take care of him. Uh, well, what I can tell you, it's really good for the chronic pain also. People with pain, back pain, or with chronic pain of the body, it gets better. And you can, if you use the ozone constantly, you can diminish all the painkillers and they take and get a better life, a better quality of life with ozone. Yeah. With trauma, well, you have to do it quickly, but it's difficult to get one patient to when they have the trauma and get the ozone. It should be, but most of the doctors say no, don't use that because we don't have to. We don't know how it works.
Hmm.
So that's the problem with that kind of patients, but it helps a lot because it gives you a lot of oxygen, and it it helps with the recovery of the patient. The sooner, the better.
You're talking specifically about a brain injury, maybe a
Yeah,
stroke or a concussion or
yeah,
some traumatic brain injury of some sort. Yeah.
yeah, yeah. Yeah,
So the oxygen crosses the blood-brain barrier?
yeah, because it's oxygen,
Mhm.
so it, it goes everywhere.
Yeah.
Uh, it's the fuel of the cell. So we
Mhm.
work, or our cells works with the oxygen, so they take it. Even the human cell or our cells doesn't realize it is also no oxygen. No, take it, it's oxygen. So
Uh-huh.
and it helps a lot, and our body cells learn to work with ozone also, and they take it where it is needed into the body. So that's interesting. So there's a theory that we have that we put the ozone and the body uses where it needed, where it needs to be used. Yeah, the cells take it as if it were oxygen because
Mhm.
it has three molecules of oxygen. So they use it. About the cells learn to work with the ozone. Also with antibiotics, they use it. They understand it's good for the body and use it and take the antibiotic from the environment and they take the this antibiotic into the bacteria to kill them. So
Ah,
they could use in this manner also the ozone. Yeah, because we take some of the patient's blood out. Yeah, from 100 cc up to 300 cc of blood, and we mix this blood with oxygen and ozone on a mix. Yeah, and we mix it, and this blood, this oxygenated blood, goes into the patient's vein again, into the circulation of the body of the patient, and it helps with all these the blood cells, the red blood cells uses this oxygen to improve all the uh, releasing of the oxygen into the entire body, and the all the white cells of the blood increases all these we call it chemiotaxis to in order to deal better with infections of
mm.
any kind. Yeah, also with the autoimmune process like rheumatoid arthritis or lupus. It helps a lot to keep this inflammation of the body down. So it's really interesting what we do with a small amount of blood of the patient, and it makes a difference. It makes a difference, and you can feel the, the wellness of it when you try it. You feel bad and you're in pain or you can't breathe. With COVID, for example, and they put this blood into you, and the oxygenated blood, and the patient feels, I feel the relief of the COVID, yeah, of the pain or whatever they feel now. It's really good.
It's quite fast acting as you experienced yourself personally when you had
Yeah,
COVID in the hospital and thought you were gonna die.
yeah,
Um,
yeah.
yeah.
I was trying.
Is this being used in a hospital setting, or do you have in Mexico only special outpatient clinics that are using this therapy?
Oh, here in Mexico, there are only still these special clinics of ozone. Yeah, because the government is not giving all these resources to the hospitals. I don't know why, but it's a well better cheap and better to the patient. Yeah, even there are some studies of the Russian, because the Russian people did a lot of research of ozone, and they use it with these critical ill patients in the intensive care units
You're talking
in
about in Russia?
Russia, and they
Uh-huh.
put this ozone uh, rectally. This is
Mhm.
another way to give the ozone to the patient, and they put this tube into the rectum of the patient and give 200 cc of ozone per dialysis. It was three times a day, and after 1 week or 2 weeks of the study, they found that this therapy uh, it was really good for the infection that the critical ill patient has when you are in the intensive care units because of the antibiotics and all the environment with all these tubes that you get into your body. Yeah, and they recovered really good from these infections, because the
Mm.
infection of these patients is really bad,
Mm.
and they die of sepsis because these infections. It could be respiratory or urinary tract infection, and they are so bad to the
Mm.
patient. Yeah, most of the cases die from pneumonia, and they could uh, improve all this with ozone.
So you mentioned insufflation. So what
Yeah, installation is
you're meaning about that, I just want to clarify for people. There's different ways to administer
yeah,
this ozone therapy. And one way is to just draw the blood out of the vein of the arm, and then you add the oxygen to the little bag that has the blood in it. And then you mix it up, and then you put it back in via an IV drip back in the own patient's blood mixed with the ozone, it back into the patient. So it goes out of your arm, gets mixed with the ozone, and goes back in via the IV drip. And with the insufflation, it is the gas itself that's being administered rectally through a small tube. And for some people, that's more comfortable, and it's a little bit less invasive in some ways, I suppose. And also, the effects maybe not are not as strong and as powerful. I've had both, and I think they both were really great and easy and simple and fast. And Felipe is amazing, and his team, Nora on his team, is incredible. So they just make the whole environment so welcoming, and I just really appreciate their energy. So there is, multiple ways to go about receiving one of these treatments. Just to put that out there, so everybody understands that. But the way that is most powerful, I would say most potent, is the IV ozone through the IV in the arm. So I don't know if you have anything else you'd like to add, if there's something else that you might want to share with people that might be considering doing this. Is there anything you might want to leave them with, Felipe?
well, we have for the patients with cancer, we have this cell therapy, the immunotherapy with placenta. Yeah, they take these stem cells from the placenta, and we could give these cells to into the IV or an implant. Also, we have the implant, and the implant has a lot of stem cells, as you know. Is 80 billion, about Spaniard billions. So it's an 8 with 13 zeros.
Quick break from the programming today, because nothing lights me up more than empowering people to make informed decisions about their health based on hard scientific facts. The ketogenic diet has stood the test of time, and the scientific literature shows us that this can be a powerful healing strategy. Don't let another day slip by when you could be doing something proactively to change your health. If you're still wondering how to begin your keto diet, it's time to stop thinking and start doing today. Just do it. Go to radicalhealthmakeover.com and download your free copy of my ebook, How to Start a Keto Diet. Now, back to the program.
We have this immunotherapy that they take from this patient that has had the cancer and recovered from cancer. So they take the urine of these patients and take out the antigens of the tumor. Yeah, and it helps like a vaccine. You take the antigen and put it into the patient via injection, yeah, a shot, and this system helps with the natural killers cells that kills tumor cells inside our body. Yeah, we have all the means to recover from cancer inside our body. Yeah, the problem here with patients with cancer is that this system is asleep totally because the tumor cells has these substances, these chemicals that avoid that the natural kill.
A cancer tumor is encapsulated with a coating that doesn't allow the natural killer T cells to penetrate and get in to actually kill the cancer cells.
And this vaccine marks these cells, and your own natural killers gets rid of the cancer cells.
There's three different things here. One is the ozone therapy that can be used in conjunction with stem cells to actually go in and reinstruct the immune system and the cells to build new healthy cells, which is really important. When you're killing cells that are damaging, you want to then replenish with cells that can sort of re-instruct the body to build new healthy cells of those tissues that have been damaged by the treatment. You want to get rid of and remove these damaged and mutated cells, like a cancer cell, for example. So then you add in the stem cells, and that gives the body an immune enhanced opportunity to really go in and build new healthy tissues. And then the other thing that you mentioned is the cancer antigen, which is, it's been studied a great deal, although it's not used that much in the United States either. But it really is a very fascinating process where they take the cancer cell, the tumor cells, and they put them into, it's like making a vaccine. It's essentially a cancer vaccine. And what happens is when the body, so a healthy body will produce antibodies against that cancer cell. And then they take those antibodies and they put them into somebody that has cancer. And they actually have a specific antigen for different specific types of cancer. So they, for example, have a breast cancer antigen, which is kind of like a breast cancer vaccine, essentially. So the body is going to produce immunity against that particular type of cancer cell in the body.
Right, correct.
Okay. So this is really exciting. And so this cancer vaccine has been around for a long time. Can you talk a little bit about the history of that? And
The laboratory is in Guadalajara City, and they use all these antigens from the patients that have recovered from cancer, and used to give the urine of these patients, and they take out from the urine all the sediments and the antigens of these cancer cells in order to do these shots of vaccine for the cancer. And it's have been, I think, for 20 years here in Mexico, and
hmm,
there are a lot of experiences here with those antigens with good results with the patients. Yeah, they
hmm,
recover and get a better um life. Yeah, because they can get better from their cancer.
mm. So their body's producing antibodies against the cancer that they have. And what you said was that they take the urine
Yeah,
from a patient who has recovered from cancer, and then they process it and take out the antibodies or the antigens from the urine of the recovered cancer patient. Is that correct?
yeah, correct.
Okay. And from that, they make essentially a vaccine. And then they inject that a small amount into the body of somebody with cancer. And then their body starts to make those same antigens or antibodies against the cancer. So that is incredible. And like you said, it's been used here for many years, and in Mexico, that is. And I don't really know if it's being used in the U.S. I don't imagine that it is. I've never heard of it, but it's exciting that it's available here, and these things are legal. They're approved. This is not some sort of underground operation. This is very much been used with professional medical doctors for decades here in Mexico. So thank you so much for joining me. This has been an excellent education, and I hope that people are learning a lot about the opportunities to heal their bodies in Mexico. So thank you again so much for joining me today, Felipe.
Thank you, Mary.
I realize that what you've heard here is a radical departure from today's politically correct nutritional guidance. If it were politically correct, it would be endorsed by the media. And if it was endorsed by the media, it would be endorsed by Big Pharma. Let's face it, Big Pharma makes money when you and I stay sick. The real truth is, you can take control of your health with an intelligently designed plan. After helping people get keto adapted for over 25 years, I have found that everyone who succeeds does 3 very specific things. I've included all 3 in my book, How to Start a Keto Diet, and you can download your free copy at radicalhealthmakeover.com.